Welcome to our exploration of brain lesions, a fascinating and crucial topic in clinical neuroscience. Brain lesions refer to areas of damaged, abnormal, or non-functioning brain tissue. These disruptions can have profound effects on how we think, feel, and behave. Whether the damage is confined to a specific spot or spread across multiple regions, lesions offer a unique window into the workings of the human brain. In this video, we'll uncover what brain lesions are, why they matter, how they're caused, and what they reveal about the organization of our minds. Let's begin by understanding the basics of brain lesions and their significance. Brain lesion is essentially an area within the brain where the tissue is damaged, abnormal, or not functioning as it should. This damage can disrupt the way neurons communicate, either in a specific location or across broader networks. The effects of lesions can range from subtle cognitive changes to significant emotional or behavioral impairments. Lesions are categorized as either focal, meaning they're confined to a particular region, or diffuse, where the damage is widespread and affects multiple areas or connections. Understanding these distinctions is key to grasping how lesions impact brain function. Studying brain lesions is central to clinical neuroscience because they allow us to make causal inferences about brain-behavior relationships. If damage to a specific brain region consistently leads to a particular impairment, it suggests that region is necessary for that function. This approach helps us understand not just where things go wrong, but why. Lesion studies bridge clinical neuropsychology, which focuses on diagnosing and treating deficits, and cognitive neuropsychology, which uses patterns of impairment to map out how cognitive functions are organized in the brain. Clinical neuropsychology uses lesion studies to understand the specific deficits that arise from brain damage. This knowledge is vital for guiding diagnosis, predicting outcomes, and designing effective rehabilitation strategies. By observing how different types of lesions affect behavior and cognition, clinicians can tailor interventions to each patient's unique needs. The insights gained from these studies not only improve patient care, but also deepen our understanding of how the brain supports everyday functions. Cognitive neuropsychology takes a different angle, using patterns of impairment from lesions to infer how cognitive functions are organized in the brain. By studying which abilities are lost or spared after specific brain injuries, researchers can map out the underlying architecture of memory, language, attention, and more. This approach has led to some of the most influential models of how our minds work, revealing the distributed nature of cognitive processing. One of the most common causes of brain lesions is a cerebrovascular accident, or stroke. Strokes occur when the blood supply to part of the brain is disrupted, often due to a clot. If the clot forms and stays in place, it's called a thrombus. If it travels and gets stuck elsewhere, it's an embolus. Strokes typically cause focal lesions that follow the brain's vascular territories, leading to sudden and specific deficits depending on the area affected. Penetrating head injuries occur when an object breaches the skull and enters the brain tissue. These injuries often result in extensive white matter damage due to shearing forces. The consequences can be severe, affecting not just the site of impact, but also the connections between different brain regions. Such injuries highlight the vulnerability of the brain's intricate wiring and the importance of white matter in maintaining normal function. Traumatic brain injury, or TBI, is caused by external mechanical forces such as falls or collisions. Unlike focal injuries, TBIs often result in diffuse axonal injury, which disrupts the connections between brain regions. This widespread damage can lead to a range of cognitive and behavioral problems, from slowed thinking to difficulties with attention and executive function. TBIs are a major public health concern due to their frequency and long-term impact. Neurodegenerative diseases such as Alzheimer's, Parkinson's, and frontotemporal dementia cause progressive tissue loss or dysfunction in the brain. Unlike focal lesions, the damage here reflects network degeneration, affecting multiple interconnected regions. These diseases gradually erode cognitive abilities and independence, underscoring the importance of healthy neural networks for everyday functioning. It's important to distinguish between focal and diffuse brain damage. Focal lesions are localized, often resulting from events like strokes, and tend to cause specific deficits such as language or attention problems. In contrast, diffuse damage is widespread, commonly seen in traumatic brain injuries, and leads to more general cognitive slowing, attention deficits, and executive dysfunction. This distinction helps explain why similar symptoms can arise from different underlying causes. To understand the impact of brain lesions, clinicians use neuropsychological test batteries. These batteries assess a range of cognitive domains, including attention, memory, language, executive function, and visuospatial abilities. By evaluating multiple areas, clinicians can identify patterns of strengths and weaknesses, which helps in diagnosis and treatment planning. Comparing patient performance to matched control groups is essential, as pre-injury baselines are rarely available. Neuropsychological assessments cover several key cognitive domains. Attention tests measure the ability to focus and sustain concentration. Memory assessments evaluate both short-term and long-term recall. Language tests look at comprehension and expression, while executive function tasks assess planning, flexibility, and problem-solving. Visuospatial abilities are also tested to gauge how well a person can perceive and manipulate visual information. This comprehensive approach ensures a thorough understanding of the patient's cognitive profile. When interpreting test results, it's important to distinguish between statistical and clinical significance. Statistical significance is based on how much a patient's performance deviates from the average, using strict thresholds. Clinical significance, on the other hand, focuses on whether the deficits actually impact daily life and independence. Sometimes, a deficit may be clinically important even if it doesn't meet statistical criteria, highlighting the value of clinical judgment alongside quantitative analysis. Clinical judgment plays a crucial role in interpreting neuropsychological assessments. While statistical analysis provides objective data, clinicians must also consider the real-world impact of deficits on a patient's daily functioning. This holistic approach ensures that important issues aren't overlooked simply because they don't meet strict statistical thresholds. Ultimately, combining quantitative and qualitative insights leads to better patient care. Lesion mapping involves pinpointing the exact location of brain damage using imaging techniques like CT or MRI. By relating these locations to observed deficits, researchers can identify which brain regions are necessary for specific functions. Lesion mapping allows for comparisons across patients with similar impairments and supports causal, rather than merely correlational, conclusions about brain behavior relationships. Today, lesion mapping often combines structural imaging with behavioral data to map out functionally relevant networks in the brain. This approach goes beyond identifying isolated regions, instead highlighting how different areas work together to support complex behaviors. By integrating multiple data sources, modern lesion mapping provides a more comprehensive view of brain organization and its relationship to cognition. Hemispatial neglect is a striking disorder of attention, not sensation. It occurs when a person loses awareness of stimuli on the side of space opposite to their brain lesion. Most commonly, this follows damage to the right hemisphere, leading to neglect of the left side of space. Importantly, this isn't due to blindness or paralysis. The sensory systems are intact, but the brain fails to attend to one half of the world. Key features of hemispatial neglect include a reduced awareness of stimuli on the side opposite the lesion, most often after right hemisphere damage. Patients may fail to notice objects, people, or even their own limbs on the neglected side. This condition is not explained by sensory loss, but by a breakdown in attention networks, particularly involving the inferior parietal lobule and frontoparietal circuits. Hemispatial neglect is most often associated with lesions in the inferior parietal lobule, intraparietal sulcus, and frontoparietal attention networks. These regions are crucial for integrating sensory information and directing attention across space. Damage here disrupts the brain's ability to represent and respond to stimuli on the neglected side, leading to the characteristic symptoms of neglect. Behavioral manifestations of hemispatial neglect include failing to cancel items on the neglected side during tasks, deviated line bisection, and producing incomplete drawings, such as drawing only one side of a clock. These signs provide clear evidence of the attentional deficit and help clinicians diagnose and monitor the condition. Blind sight is a remarkable phenomenon where patients with damage to the primary visual cortex, V1, report blindness in part of their visual field, yet can still respond to visual stimuli at above chance levels. This means they have no conscious visual awareness, but their brains can still process some visual information. Blind sight demonstrates the complexity of visual processing and the existence of parallel pathways in the brain. Key features of blind sight include a lack of conscious visual experience, yet preserved performance in forced choice tasks. Patients can guess the location or movement of objects in their blind field with surprising accuracy, even though they insist they can't see anything. This dissociation between perception and awareness challenges our understanding of consciousness and visual processing. Blind sight highlights the existence of parallel visual pathways in the brain. Even when the primary visual cortex is damaged, other pathways can still process visual information without reaching conscious awareness. This finding has profound implications for our understanding of how the brain supports perception and consciousness. Lesion studies have taught us that cognitive functions are distributed across networks rather than isolated in single brain regions. They show that awareness and performance can dissociate, and that brain regions are necessary but not sufficient on their own. These insights have revolutionized our understanding of how the brain supports complex behaviors and cognition. Cognitive functions such as memory, attention, and language are not confined to single brain regions. Instead, they arise from the interaction of multiple areas working together as networks. Lesion studies provide some of the strongest evidence for this distributed organization, challenging the idea of single centers for complex abilities. One of the most intriguing findings from lesion studies is the dissociation between awareness and performance. For example, patients with blind sight can perform visual tasks without conscious awareness. This shows that the brain can process information and guide behavior even when we're not consciously aware of it, revealing the complexity of neural processing. Lesion studies also show that while certain brain regions are necessary for specific functions, they are not sufficient on their own. Cognitive abilities depend on the interaction of multiple areas, and damage to one part can disrupt the entire network. This perspective has shifted neuroscience away from searching for single centers and toward understanding interconnected systems. The insights gained from lesion studies have important clinical implications. They inform diagnosis, guide rehabilitation, and help predict outcomes for patients with brain injuries or diseases. By understanding which networks are affected, clinicians can develop targeted interventions to support recovery and improve quality of life. Rehabilitation after brain lesions often involves retraining or compensating for lost functions. Therapies may focus on strengthening remaining abilities, teaching new strategies, or using assistive technologies. The goal is to maximize independence and help patients adapt to changes in their cognitive and behavioral functioning. Predicting outcomes after a brain lesion depends on several factors, including the location and extent of damage, the patient's age, and their overall health. Lesion mapping and neuropsychological assessments provide valuable information for estimating recovery potential and planning appropriate interventions. Let's consider a case study of stroke. A patient suffers a stroke affecting the left hemisphere, resulting in language deficits known as aphasia. Neuropsychological testing reveals specific impairments in speech production and comprehension. Lesion mapping pinpoints the affected regions, guiding targeted speech therapy and rehabilitation efforts. In another case, a young adult experiences a traumatic brain injury from a car accident. The injury causes diffuse axonal damage, leading to slowed thinking, attention deficits, and difficulties with planning. Rehabilitation focuses on cognitive retraining and compensatory strategies to help the patient regain independence and adapt to daily challenges. The third case involves an older adult with Alzheimer's disease. The progressive degeneration affects multiple brain networks, leading to memory loss, disorientation, and changes in personality. Neuropsychological assessment tracks the progression, while interventions focus on maintaining function and supporting daily living as long as possible. Early detection of brain lesions is crucial for effective intervention. The sooner a lesion is identified, the better the chances of minimizing long-term deficits and maximizing recovery. Advances in imaging and assessment tools have greatly improved our ability to detect and respond to brain injuries and diseases. Support networks, including family, friends, and healthcare professionals, play a vital role in recovery after brain lesions. Emotional support, practical assistance, and encouragement can make a significant difference in a patient's rehabilitation journey. Building strong support systems is an essential part of holistic care. Technological advances in brain imaging, assessment, and rehabilitation have transformed the field of clinical neuroscience. Tools like MRI and CT scans allow for precise lesion mapping, while computer-based cognitive training programs offer new ways to support recovery. These innovations continue to improve outcomes for patients with brain lesions. The future of lesion research lies in integrating genetic, molecular, and network-level data to gain a deeper understanding of brain function and dysfunction. Personalized medicine approaches, informed by detailed lesion mapping and cognitive profiling, hold promise for more effective and individualized interventions. Ethical considerations are central to lesion research and clinical practice. Issues such as informed consent, privacy, and the responsible use of data must be carefully managed. Ensuring that patients' rights and dignity are respected is a fundamental principle in all aspects of neuroscience. Raising public awareness about brain lesions and their effects is important for reducing stigma and promoting understanding. Education campaigns can help people recognize the signs of brain injury and support those affected. Greater awareness leads to earlier intervention and better outcomes for patients. Collaboration between researchers, clinicians, and patients is essential for advancing our understanding of brain lesions. Multidisciplinary teams bring together diverse expertise, leading to more comprehensive research and improved patient care. Working together accelerates progress and innovation in the field. Hearing directly from patients who have experienced brain lesions provides valuable insights into the challenges and triumphs of recovery. Personal stories highlight the resilience of the human spirit and the importance of support, rehabilitation, and hope in the journey toward healing. Summarize, brain lesions can result from various causes, including stroke, injury, and disease. They disrupt neural processing and provide a unique window into how the brain supports cognition and behavior. Lesion studies have revolutionized neuroscience, revealing the distributed nature of cognitive functions and the importance of networks over single centers. The main takeaway is that brain lesions teach us about the necessity of networks for cognitive function, the dissociation between awareness and performance, and the value of integrating clinical and research perspectives. Understanding lesions not only advances science, but also improves patient care and quality of life. As research continues, we can expect even greater insights into the brain's organization and the development of more effective interventions for those affected by lesions. The integration of new technologies and collaborative approaches will drive future discoveries and improve outcomes for patients worldwide. Thank you for joining us on this journey through the world of brain lesions. By understanding how damage shapes the mind, we gain not only scientific knowledge, but also compassion for those affected. Continued research and collaboration will ensure that we keep making progress in both understanding and treating brain lesions.